Now that we've learned more about yoga and more about the research that shows us that yoga can be effective for many chronic pain conditions, it's time to start learning some practices. So most of us think about yoga as the movements that we do in yoga, but there are many other things that we want to do in yoga, such like breathing and body awareness and relaxation and meditation. And today we're going to start with a breath awareness practice. So the best thing to do would be to get into a nice comfortable position, either a seated position or a laying down position. If you're best on your side, then lay on your side. If you're best laying on your back, do that. But the one place you want to be careful not to use too much for the kind of practices like this is laying down in your bed in the position where you usually sleep. Because that's a place where your mind is going to be thinking that it is time to go to sleep, whereas with this practice we want you to try to stay awake and stay alert. So if you can position yourself that way, that would be great. We're going to be here for maybe 5 or 6 minutes. If you can have a piece of paper and a pen handy, that would help too. Because then you can write down the experiences that you have at the end, maybe the things that you notice or the things that you don't notice as you go through the practice, or maybe the things that you'd like to work on next time you try this practice. And that is the idea, that I'm going to guide you through it here today. And what I'd like you to try to do is to do this at least once every day for the next week, and then we can talk about this more next week when we get back together again. So with that piece of paper and pen handy and laying down or sitting down in a comfortable position, what I'd like you to do is just let your eyes close or soften your gaze and bring your awareness to your breath. So start by feeling the air coming in and out of your nose. So as you breathe in and as you breathe out, see if you can feel the air coming in your nose and going out your nose. Now if by chance today that you're feeling a little stuffed up, it's okay to breathe in and out through your mouth. But we found that the best way overall is to do it through your nose. So if you can, feel the sensation of the air as you breathe in, and feel the sensation of the air as you breathe out. See if you can feel the sensation of the air as it passes through nostrils, and see if you can feel the sensation of the air as it passes through the back of your nose and the back of your throat. Notice whether the sensation of the air moving is that it's moving smoothly and softly. Notice whether the air might be moving a little bit ragged. Maybe it's not smooth at all. But however you're breathing, just notice that. For today's practice, we're not trying to change. We're just trying to see how much we can feel the breath, how much we can feel what happens when we breathe. So you're noticing the air as it comes in and noticing the air as it goes out. And see if you can notice how long it takes to breathe in. Sort of count the beats as you breathe in. How many beats does it take? And as you breathe out, how many beats does it take? And see if you can notice the pace of your breath. So as you breathe in, notice that the air movement's the same all the way through the inhale and all the way through the exhale. Or whether there's times when it's faster. Notice whether it's faster at the beginning or faster at the ending. And do that for both your inhale and for your exhale. And notice if there's a difference between your inhale and your exhale. Maybe you notice that the pace of your inhale is faster or the pace of your exhale is faster. Just let your mind rest on those feelings so you can really get into the feeling of your breath. Really get into the awareness. And as you're breathing, see if you can feel your body moving as well. So you breathe in, you can feel the air coming in, feel the air going out. See if you can feel your body moving as you breathe in, and feel your body moving as you breathe out. And notice the parts of your body that you can feel moving. Maybe you can feel your chest. Maybe you can feel your ribs. Maybe you can feel your belly moving as you breathe. And sometimes we can feel the movement of our body at the front of our rib cage, Sometimes we can feel it at the back of the rib cage. Just notice where you move when you breathe. And maybe there's movement of your shoulders or movement of your collarbones as you breathe in and breathe out. See if you can notice if there's anything happening there. And then see if you can pay attention to the sound of your breath. Listen to the sound of the air as it comes in. And listen to the sound of the air as it goes out. Notice whether that sound feels even or sounds even all the way through the inhale and all the way through the exhale. Notice if your breath stops at any time in terms of the sound. Notice if the quality of the sound changes through your inhale, through your exhale. Then shift your awareness back to your body again. And as you breathe in and you breathe out, notice if there's any spots that feel tense. And maybe you can even feel that tension changing as you breathe in and breathe out. See if you can go to those spots of your body where you normally feel tense, or maybe the spots of the body where you have pain. And notice as you breathe in and as you breathe out, is there any change in that tension? Do you find that the tension increases or decreases at any point during your inhale? Increases or decreases at any point during your exhale? And then imagine you are going to describe how your breathing feels to someone else. See if you can come up with some words to describe the sensations that you get as you breathe in and the sensations that you get as you breathe out. Sometimes this is hard, but see if you can come up with some words. Notice if there's any thoughts that arise as you breathe in and you breathe out. Sometimes as we breathe in, we sort of think some things or notice some things. For some people, images might come up, and for some people, thoughts come up, and sometimes even colors come up when people breathe in and breathe out, when we take the time to notice. And see if there's any emotion attached to your breath. As you breathe in and you breathe out, notice whether you feel any emotion. Maybe you will, maybe you won't, but just give it a try. As you breathe in, see if there's any emotions that you feel. As you breathe out, see if there's any emotions. Now as you finish your exhale, bring your awareness back to the feeling of the air coming in and out your nose. Then once again, shift your awareness to the inside your nose through the sinus area and see if you can feel the air coming in, feel the air going out there. Then shift your awareness back to the back of your throat again and see if you can feel the air coming in, the back of your throat, out the back of your throat. And then once again, notice the sound of your breath. As you breathe in, can you hear the sound of your breath? And does the sound stay the same the whole way through your inhale and the whole way through your exhale? Or does it change? Once again, notice the pace of your breath. Does it feel like the air moves equally all the way through the inhale, all the way through the exhale? And does it feel like the pace is the same on the inhale as it is on the exhale? And see if you can notice that space between the inhale and the exhale, and the space between the exhale and the inhale. And just notice what that's like. Notice how big it is. Notice how long it lasts. Notice if there's a difference in that spot between the inhale and exhale compared to the spot between the exhale and the inhale. And then take your awareness once again back to your body, and as you breathe in, see if you can feel your body moving as you breathe in. Notice if there's any movement happening down around your ribs, any movement happening around your belly, any movement happening around your chest or your shoulders as you breathe in and as you breathe out. And once again, notice those areas of your body that tend to be tense, or the areas that are tense right now, or that have pain right now. And see what happens in those areas when you breathe in. See if it changes as you breathe in or changes as you breathe out. Or maybe it even changes in that pause between the inhale and exhale and inhale. And then once again, bring all your awareness back to the sensation of your breath, coming in your nose, going out your nose. See if you can focus all your awareness on that. The air as it passes in, the air as it passes out. And then let yourself take a few deeper breaths and maybe blink your eyes open or slowly open your eyes back up again. And just think back on the things that you noticed as you breathed. And then maybe pick up that pen and paper and write down the things that you noticed. And what we'd like you to do is to continue to do this simple exercise each day at least once until we come back again and have our question and answer period. Thanks, and we'll talk to you again soon.